one of the things that you learn as a pharmacist very early on is the more barriers you put between a patient and their medication, the less likely they are to take it. And so distance is definitely one of those things, distance, cost, ease of use, number of times they got to take it. All those things matter. And so distance is definitely a big factor. If a patient can't get to you to get their medicine or they no longer drive, like all of these things factor into the cost of healthcare. And that matters because your tax dollars are going to pay for some of that, whether you want them to or not, they do. So it behooves everyone in America to get on the bus about making healthcare accessible and cheaper, and that includes prescription drugs, because when a patient can care for themselves, the overall spend for healthcare goes down.
Sure. And when people can affordably do this, the abuse of resources also
Mhm.
goes significantly lower.
Yes,
We
correct.
know that people end up in the emergency room all the time because they don't have access to their blood pressure
Mhm,
medicine,
mhm,
and when
mhm.
we're talking about like fiscal responsibility of programs like Medicare and Medicaid,
Mhm.
we have to think about that as a as a comprehensive pie,
Right.
not just slices. And